Good morning, everyone. I would like to lecture regarding the Universal Healthcare Law, or the RA 11223. Alright, so let's see a little background regarding our Philippine healthcare system. Although the Philippines has shown significant improvements in health outcomes, it continues to deal with inequities and new challenges that threaten the health of its population. Life expectancy at birth has increased from 62.2 years in 1980 to 69.1 years in 2016. This was brought about by the improvements in living conditions, better health access to health services, and improved management and treatment of infectious diseases over those past years. However, those in lower wealth quantiles with lower education attainment or in rural areas are still at a disadvantage. Family planning and maternal and child health indicators, for example, show that compared to the national average, these population groups have higher infant mortality and fertility rates, and lower percentage of deliveries that occur in health facilities and are assisted by skilled health providers. The health system is now facing a triple burden: health impacts brought about by urbanization, globalization, and climate change, the rise of non-communicable diseases, and the reemergence of communicable diseases. Filipinos also continue to suffer a heavy financial burden from health spending. The incidence of catastrophic spending has been increasing for all income groups. In 2012, around 1 million people were impoverished by high out-of-pocket payments, and in 2018, 53.9% of total health expenditures was from out-of-pocket payments. That is according to the PSA in 2019. So, health is recognized as a basic human right by the 1987 Philippine Constitution, which declares that the state shall protect and promote the right to health of the people. Over the years, the Philippines has undertaken various health sector reforms toward achieving universal health care. In 2010, this became an official priority of the health sector under the program Kalusugan Pangkalahatan, the Tagalog translation of universal health care. These reforms culminated in the enactment of the Universal Healthcare Law in February 2019. Yan. So, what does universal healthcare law mean? So, UHC means all Filipinos are guaranteed equitable access to quality and affordable healthcare goods and services and protected against financial risk. President Duterte signed RA 11223, or the Universal Healthcare Act, into law last February 20 of 2019. The UHC Act contains comprehensive and progressive reforms that will ensure every Filipino is healthy, protected from health hazards and risks, and has access to affordable, quality, and readily available health service that is suitable for their needs. And so the Philippine UHC law presents health system reforms necessary to expand financial protection and access to health services to all Filipinos. This landmark legislation adopts a whole of system, whole of government, whole of society, people-centered approach to improve overall health system performance. It aims to progressively realize UHC in the country, ensuring that all Filipinos are guaranteed equitable access to quality and affordable healthcare goods and services and are protected against financial risk. Yan. So, the UHC law mandates structural, functional changes in health financing, service delivery, and governance. This law aims to address the issues of the country's fragmented health system through the establishment of province or citywide health systems. To test this reintegration, a transition period of 6 years has been allotted for 33 selected provinces to implement the Universal Healthcare Law with technical and financial support from the national government. Evidence and knowledge gained from these sites will provide valuable inputs to the ongoing development of supporting policies by the Department of Health. the Philippine Health Insurance Corporation, or the PhilHealth, the national health insurance program of the country, to support the eventual national rollout of the Universal Healthcare Law. And under the leadership and governance of the Universal Healthcare Law, the Philippine health system is highly devolved, with significant responsibilities held by the country's 1,488 municipalities. Relationships between the DOH and municipal, city, and provincial governments complicate policy implementation. PhilHealth's role has grown organically as it purchases a disparate set of benefit packages from a variety of public and our private agencies. And also, under the leadership and governance, the UHC law aims to clarify and delineate the overlapping functions of government agencies. The law revisions the role of the DOH to be more focused on regulation, policy development, and standard setting, guiding implementations at the local level, while PhilHealth transitions to become a stronger and more dominant national purchaser of services. Yan. So, still under the leadership and governance, at the local level, the public system will be reorganized as province or citywide health systems, within which our healthcare providers, what we call network or HCPNs, will be formed. Municipal level governments that currently lead and manage local health systems will transfer these functions to their respective provincial and city governments, which will become the focal points of local health governance. They will be responsible in terms of administrative and technical supervision, health service delivery, and local health system management. Yan. So, regarding the PhilHealth membership benefits and financing on the Universal Healthcare Law, the PhilHealth membership is currently achieved through a variety of subsidized and contributory schemes. Ayan, so PhilHealth reportedly covers 92% of the population, but a significant proportion of its members are unaware of or unable to access their benefits. PhilHealth benefit packages are specific to type of membership and provider payment systems to equally complex and with different approaches applied to different benefit packages. So, under the UHC law, all citizens are automatically entitled to PhilHealth benefits, including comprehensive outpatient services. Yan. So, the PhilHealth will be responsible for purchasing all individual-based services, including supplies, medicines, and commodities, as well as maintenance and operating expense of health facilities. PhilHealth provider payment systems will be reformed towards global budgets of contracted healthcare provider networks. The DOH will maintain responsibility for population-based services as well as salaries for government healthcare workers. And so the law strengthens PhilHealth by transforming it to become a national purchaser of individual-based health goods and services. To support this larger purchasing role of the PhilHealth, premium contributions to PhilHealth will be complemented by increasing government contributions from sin taxes, annual appropriations, and revenues from the Philippine Amusement and Gaming Corporation and the Philippine Charity Sweepstakes Office. So, under the Universal Healthcare Law on service delivery, the delivery of public primary healthcare services is currently controlled at the barangay and municipal level. Patients struggle to access a continuum of care across administrative boundaries. The DOH faces challenges in signaling strategic priorities to primary care providers and in enforcing quality standards. And so, to address the fragments of service delivery and move towards providing comprehensive and integrated care, providers are encouraged to form province and citywide healthcare provider networks. These networks can be composed of public, private, or a mixed set of providers that will deliver primary, secondary, and tertiary services. healthcare provider networks will prioritize strong primary care, and primary care providers will deliver the continuous, comprehensive, and coordinated first contact care, as well as manage navigation of a facilitated referral system. Yan. So, under the human resources, on the UHC law, there is a chronic deficiency of healthcare professionals, especially in GIDA areas, or the geographically isolated and disadvantaged areas. Some of the main reasons for this include difficulty in attracting personnel, lack of resource to finance the positions, or weak prioritization by the local government units, or the LGUs. Additionally, undergraduate training programs for health professionals in the country do not feature specific training for the provision of primary care. To address healthcare worker deficiency in the short term, the Department of Health will expand its deployment programs to augment workforce needs. All government-sponsored scholars will be mandated to serve in the Department of Health identified areas for at least 3 years. In the long run, the law envisions that LGUs will be capable to independently finance and manage their own health workforce. The law also focuses on strengthening the provision of primary care through appropriate training of human resources. It mandates a realignment of undergraduate and graduate curricula for health professions to focus on forming essential primary care competencies. While this long-term change is being pursued, a primary care certification will be required for health professionals to practice as primary care providers. This certification started last year, 2021. Under the Health Information System of the UHC Law, health information systems have been challenged by lack of structural and technical capacities, duplication of efforts, and unconsolidated and incomplete data. Lack of interoperable mechanisms to bring together multiple information systems led to inefficiencies and restrict data consolidation. The UHC law mandates and maintains the interoperable information systems and standardizes the necessary health data for collection and from providers, which are required in licensing and contracting agreements. So let's see the difference on the before the implementation of the universal healthcare and the implementation of the UHC law. And so under the leadership and develop and governance, national on the features of national government, before the universal healthcare law, gaps in licensing and regulation of health facilities by the DOH, particularly primary care facilities. The UHC law mandate mandatory licensing and regulatory systems by DOH for all health facilities, including primary care facilities. And on the local government or the provincial and municipal office, before the UHC, it is a fragmented administrative, technical, financial, and operational management of local health systems down to the individual municipalities. On the UHC law mandate, province and citywide integration of administrative, technical, financial, and operational management of local health systems. Yan. So, under financing, on the features of coverage before the UHC, multiple membership schemes that make member management inefficient. Under the UHC law mandate, guaranteed PhilHealth membership for all citizens, simplified two-tiered membership scheme, which is the direct and in the indirect contributors. On the purchases, before the UHC, PhilHealth purchases services from providers through piecemeal benefit packages and reimbursements. On the UHC law mandate, prospective performance-based global budget payments is for the healthcare provider networks. So on the fund source, overlap before the Universal Healthcare Law, the overlap in population and individual-based services funded by DOH and PhilHealth. And on the UHC Law mandate, population-based services financed by DOH and LGUs, individual-based services financed by the PhilHealth. And on the salaries before the UHC, public sector salaries paid by national and or local government. And on the UHC law mandate, no change. Intervening laws, civil service regulation, and political landscape restrict opportunities to move to performance-based payment of salaries. Yan. So, under the service delivery structure, the point of contact before the Universal Healthcare Law, the first contact care sought at in any level of care. So, kahit diretso sila sa hospital, pwede. And under the UHC law mandate, continuing comprehensive and coordinated referral system managed by a primary care provider. We need proper referral systems first. And on the provider, before the Universal Healthcare Law, fragmented delivery of services at various levels of care. Healthcare provider networks organized within province or citywide health systems. Yan, so on the access of medical products, on prioritization before the universal healthcare, no institutionalized, objective, and transparent prioritization process. And after the UHC law mandate, the HTA institutionalized through the HTA Council for All Medical Goods, yung sinasabi natin na HTAC kanina. Yan, so procurement, inefficient per facility procurement, prone to bidding failures, and ultimately stockouts during the before UHC implementation. After the UHC law mandate, centralized or pooled procurement mechanisms for drugs and medical devices to leverage economies of scale, improved negotiation leverage. On the workforce, on training, before the Universal Healthcare Law, general undergraduate training as default primary care training, but with recognized inadequacies. After the UHC law mandate, the undergraduate and graduate training and the curricula designed and realigned to focus on primary care competencies. And on the primary care certification, before the Universal Healthcare Law, no required certification to practice primary care. However, on the UHC law mandate, certification based on primary care competencies required for primary care providers. So under the health information system, on the platform before the UHC law, multiple existing health information systems with limited interoperability. Under the UHC law mandate, interoperable health information systems required for all health service providers and insurers and should be accessible to the public. On the data before the Universal Healthcare Law, unconsolidated and incomplete data that translate to poor quality and limited opportunities for analysis and utilization. Before the UHC law mandate, the standardized data submitted by health facilities as a requirement for licensing and contracting. And so, the Philippine UHC law addresses the inequities faced the country's health system because of fragmented service delivery and inefficient financing systems. The government and its stakeholders continue to work towards a responsive health system that delivers quality care without the risk of financial burden to its citizens. The UHC law addresses the health system challenges through guaranteeing access to appropriate health services for all Filipinos through functional healthcare providers networks, ensuring strategic and adequate financing and purchasing services, engaging local governments to effectively manage local health systems, and building capacity in terms of qualified human resources and seamless information systems. So hopefully you have understand the universal healthcare law, since this law affects our nursing profession, and it is a mandate for us to know regarding the universal healthcare law. Thank you.